But James, I believe you have spent a couple of months in Gaza yourself. I don't know how long ago that was, but just give us an idea of what you saw.
So it's been a few months now since I was last in Gaza, but of course I'm in contact with friends and colleagues there every day. The news that we're hearing from the north of Gaza in particular in the last couple of days, couple of weeks, is beyond horrific. What we're seeing now is an accelerated phase of the genocides. We're seeing ethnic cleansing ongoing. We're hearing from friends and colleagues, some of whom are now trapped in the remaining hospitals in the north of Gaza, hospitals such as Kamal Adwan, which are still treating hundreds of patients, surrounded, completely besieged now, shots fired into the hospital, shelling of the hospital grounds. The situation now is so precarious that the bodies of people that have been killed, rescue workers can't actually go out into the street to retrieve these bodies. In the months since I was there in June, the situation has only deteriorated. Now what we see is, of course, continued violence throughout the entirety of the Gaza Strip by Israeli occupation forces, and of course the Israeli Air Force, which continue to strike residential areas, increasingly densely populated residential areas from the north to the south.
Yeah, and the United States, as the priority, needs to be getting humanitarian aid into the north of Gaza. If that aid does manage to get into the north, what we talk about aid in these general terms, but specifically from your point of view as an emergency doctor, what are the exact medicines that you need straight away to go in there?
I mean, I think, to be frank, we need to stop talking about humanitarian aid. And this isn't to say that immediate humanitarian needs aren't phenomenally high right now, but the solution isn't humanitarian assistance. This sort of 30-day ultimatum that the US government has again issued to Israel is absurd. It's grotesque, frankly. There is no amount of humanitarian aid that can remedy the situation that we see right now in the absence of an immediate cessation of violence. The hospitals here are completely inundated. They don't have even the most basic equipment. No more blood units, no chest seals, no chest drains, no basic medical care to treat people in Gaza at the moment.
So what you're saying is that, I mean, and I know it's a big if there was a ceasefire and then those medicines were allowed to flood into northern Gaza and indeed the whole of Gaza, you're saying that those items you just listed, they would be the first things that you'd want to see go in?
I mean, the needs right now, of course, relate to immediate acute trauma care. And all of those things are in absolutely short supply because the trauma-related needs are unimaginable at the moment. But the entire healthcare system has been decimated. We're talking about primary and secondary healthcare here. The amount of medical support that will be needed to assist the Palestinian healthcare system to get back to its once functional state will be phenomenal in sort of volume, sustained sort of and continuous supply for several months and frankly several years in order to fully recover from this.
Really appreciate your time, James. Thank you so much for your insight, Dr. James Smith there, emergency doctor from London.